Hi, I'm Dr. Toyos of Toyos Clinic. We've had a dry eye clinic for over 20 years. I've tried many different drops, and one of the drops that I like the most is Oculocin. And what we're going to do is, this is the Oculocin training video. So before we get into that, let's just talk about dry eye. So I tell people your tear film is made up of 3 parts: a protein layer, a fat layer, and a water layer. So let's go here. So normally with dry eye, the most important layer and the one that patients have the problems with is the fatty layer. These are the glands on the lid margin of the Meibomian glands, and they're responsible for producing the fatty layer of your tear. If these glands aren't working properly, you don't have a normal fatty layer. This gland right here is the lacrimal gland, and that's responsible for the water layer. And then you have some cells on the eye called goblet cells that are responsible for the protein layer. But like I said, the most important one is here where these Meibomian glands are, and you can see they're at the lid margin, right where your eyelashes are. Now when the Meibomian glands aren't working normally, what can happen is bacteria can grow on the eyelashes, and this can cause a condition called blepharitis. So dry eye, blepharitis, Meibomian gland dysfunction, they all are part of the same complex. And then there's some patients that have a problem in their lacrimal gland so that they're not making proper water, and that's patients who have something called Sjogren's syndrome. And that's about 10% of dry eye, but 90% of the dry eye is Meibomian gland dysfunction. Now when you don't have your normal fatty layer, that causes a lot of inflammation, and that inflammation can cause the goblet cells not to secrete normal protein. So you can see they're all related. As the Meibomian glands work less, that inflammation causes the glands to work even less, and then it's just a downward cycle. And then when these glands aren't working properly, more bacteria grow, and you can also get a parasite called Demodex that grow on the eyelashes. So what is Oculocin, and how does that help all of this? So Oculocin is an all-natural drop that's made of Chamomile, Propolis, and Aloe Vera. So all 3 of those you're very familiar with, that we use on the skin to decrease inflammation and kill bacteria. So what they would be able to do with Oculocin is create a tear that has all those 3 elements in it to decrease inflammation and to decrease bacteria. So it helps with blepharitis, and it helps with dry eye in the fact that it's decreasing inflammation, and with blepharitis that it's killing bacteria on the lid margin. So as an artificial tear, it's not only just lubricating the eye, which most artificial tears do, but it's actually doing some healing. I can remember my grandmother, when I would have a sty, which is a blocked Meibomian gland, one of the things that she would say is, here, take a warm tea bag and put it over. And the funny thing is that tea bag had chamomile in it. So maybe some of these older remedies that we've been using back in the past, maybe there was a rhyme or reason to them why they worked, and maybe these natural products may be the way to go. Now with other artificial tears, they have to put preservatives and other chemicals in them that, if you're going to be using a tear on a daily basis, may not be the best thing for your body and for your eyes. So that's one of the reasons why I like it. So let's see, when you get your box of Oculocin, you're going to open it up, and the first thing you'll see is that there's a little kind of chemical or sheet that you can read all about, all the ingredients in it, and how to use it. And then there's 10 of these vials that come in each box of Oculocin. Now one of the great things about it is that you can open this up. You can open one of these vials up, and you just pull it up, yep. And one of the things that I tell patients is the drop tends to go to the bottom. So what you want to do is, when you turn it over, you just kind of want to tap so it goes down. So you can tap that a little bit more. until it goes down. So when the drop goes all the way down, then it's ready to use, and then you can go ahead and put it in your eye. Good. And the great thing about it is you can actually reseal these vials. So, you know, it's good for 24 to 48 hours once you open it. There's about 6 to 8 drops in each vial. So once you recap it, you know, you can use it 1 drop in each eye, recap it, and then you can use it later. And how we use it in our office is if you use it as an artificial tear, you can put 1 drop in each eye as needed. But if you're going to use it more as for medicinal purposes, if you have chronic dry eye or chronic blepharitis, you want to use it twice a day. So what you'll do is you'll open it up, put 1 drop in each eye, then close it back up, and then the next 12 hours later, put another drop in each eye, close it up, and then use that same vial the next day. And then once you're done with the vial, you just throw it away. And then with 10 of those vials in there, that should last you close to a month. And so usually patients get 1 box per month if they're going to use it on a regular basis. And if they're just using it as their artificial tear, then a box can last them much longer. So we've been really excited about the release of this drop here in the United States. It's not available in any stores. You'll have to go to your doctor to get it. There are certain doctors that already have the drop. You can check with Toyos Clinic and we can tell you which doctors have that drop available. Thank you very much.